Osteoporosis is a disease where the strength of the bone becomes compromised over time. That can occur for a lot of reasons. The primary population and reason for that to occur is postmenopausal women over the age of 50. Once they become postmenopausal, they can lose up to a third of their bone mass in the first 5 to 7 years, which lends itself to a weakening of the bone and subsequently to a high risk for fracture. Men are also prone to osteoporosis over the age of 70. As their bone becomes weaker and more brittle, they are also at risk for fracture. Osteoporosis most of the time is a silent disease. It's a silent disease that most people are unaware of until they have an initial fall and subsequently an initial fracture, and that should raise a red flag warning that there may be issues with the underlying bone strength or composition of the underlying bone quality. And the only way to truly know whether or not someone has osteoporosis prior to a fracture is to consider a bone DEXA scan or bone densitometry, which is recommended for women at the age of 65 just based on age, or men and based on age at the age of 70. Women and men over the age of 50 who have a history of tobacco abuse, alcohol use, chronic steroid use, history of rheumatoid arthritis, history of fracture, or parental history of hip fracture are at risk and should have a bone density checked much earlier. So you can reach out to your primary care provider, who is oftentimes the initial initiation into the bone health world, so to speak. You can reach out to us here at DePaul Hospital and DePaul Orthopedics, where we have a dedicated bone clinic that will evaluate you with a bone density and determine your risk based on your risk factors, and risk stratify you to determine what is the best treatment that may be necessary. Sometimes it can be as simple as some routine or regular calcium and vitamin D supplementation. Sometimes, or more times than not, it could be a prescription medication to reduce your risk of a fracture. But ultimately what we're trying to do is strengthen your bone in an effort to reduce the risk of fracture.